81. What is a common early warning sign of an asthma attack? A. Chest tightness. B. High fever. C. Swollen hands. D. Slow breathing. Answer: A. Chest tightness. Rationale: chest tightness is a common early warning sign of an asthma attack. Fever, B, is more common in infections, not asthma. 82. Which of these exercises is most suitable for someone with asthma? A. Swimming. B. Running in cold air. C. High-intensity interval training. D. Long-distance running. Answer: A. Swimming. Rationale: swimming is often well tolerated by people with asthma because warm, humid air helps keep airways open. 83. What is exercise-induced bronchoconstriction, EIB? A. A heart condition. B. Narrowing of the airways during exercise. C. A lung infection. D. A stomach disorder. Answer: B. Narrowing of the airways during exercise. Rationale: EIB refers to airway narrowing triggered by physical activity, making breathing difficult. 84. Which of the following is a common asthma trigger? A. Mold. B. Strong odors. C. Air pollution. D. All of the above. Answer: D. All of the above. Rationale: mold, strong odors, and air pollution can all trigger asthma symptoms. 85. What role do mast cells play in asthma? A. They produce antibodies. B. They release histamine and cause inflammation. C. They increase lung capacity. D. They repair lung tissue. Answer: B. They release histamine and cause inflammation. Rationale: mast cells release histamine, leading to inflammation and airway constriction, worsening asthma symptoms. 86. What is the main effect of leukotriene receptor antagonists like montelukast? A. They relax airway muscles quickly. B. They block inflammation-causing chemicals. C. They increase mucus production. D. They thicken airway walls. Answer: B. They block inflammation-causing chemicals. Rationale: montelukast blocks leukotrienes, chemicals that cause airway inflammation in asthma. 87. Which food is most likely to trigger asthma symptoms? A. Fresh fruits. B. Dairy products. C. Processed foods with sulfites. D. Whole grains. Answer: C. Processed foods with sulfites. Rationale: sulfites, found in processed foods, can trigger asthma symptoms in some people. 88. Which breathing technique can help people with asthma? A. Pursed lip breathing. B. Holding the breath for 30 seconds. C. Rapid, shallow breathing. D. Hyperventilation. Answer: A. Pursed lip breathing. Rationale: pursed lip breathing helps control breathing, keeping airways open longer. 89. What is the purpose of allergy testing in asthma management? A. To find out what foods to eat. B. To identify asthma triggers. C. To cure asthma. D. To measure lung capacity. Answer: B. To identify asthma triggers. Rationale: allergy testing helps people with asthma identify triggers to avoid and manage symptoms. 90. What does a green zone reading on a peak flow meter indicate? A. Poor asthma control. B. Normal lung function. C. Severe airway narrowing. D. An upcoming asthma attack. Answer: B. Normal lung function. Rationale: a green zone reading means good asthma control and normal breathing. 91. Which of the following is a common side effect of inhaled corticosteroids? A. Weight loss. B. Increased heart rate. C. Oral thrush. D. Excessive sweating. Answer: C. Oral thrush. Rationale: inhaled corticosteroids can cause oral thrush if the mouth is not rinsed after use. 92. What is the role of eosinophils in asthma? A. They increase oxygen levels. B. They trigger inflammation in the airways. C. They produce mucus. D. They reduce swelling in the lungs. Answer: B. They trigger inflammation in the airways. Rationale: eosinophils are immune cells that contribute to airway inflammation in asthma. 93. Which of the following describes mild, intermittent asthma? A. Symptoms occur daily. B. Symptoms occur twice a week or less. C. Symptoms occur every night. D. Symptoms require daily medication. Answer: B. Symptoms occur twice a week or less. Rationale: mild, intermittent asthma means infrequent symptoms, usually less than twice a week. 94. What should you do if you suspect someone is having an asthma attack and their inhaler is not helping? A. Wait 30 minutes to see if they improve. B. Encourage them to lie down. C. Seek emergency medical help immediately. D. Offer them food. Answer: C. Seek emergency medical help immediately. Rationale: if an inhaler is not relieving symptoms, emergency medical help is needed. 95. What is the most common type of inhaler used for long-term asthma control? A. Short-acting beta-agonists. B. Inhaled corticosteroids. C. Antihistamines. D. Decongestants. Answer: B. Inhaled corticosteroids. Rationale: inhaled corticosteroids help reduce airway inflammation for long-term control. 96. Which of the following medications is not commonly used for asthma? A. Antihistamines. B. Inhaled corticosteroids. C. Leukotriene receptor antagonists. D. Beta-2 agonists. Answer: A. Antihistamines. Rationale: antihistamines treat allergies, but are not the primary treatment for asthma. 97. How does smoking affect asthma medications? A. It makes them more effective. B. It reduces their effectiveness. C. It has no effect. D. It cures asthma. Answer: B. It reduces their effectiveness. Rationale: smoking worsens asthma and makes medications less effective. 98. What is the goal of asthma treatment? A. To eliminate asthma completely. B. To reduce symptoms and prevent attacks. C. To increase mucus production. D. To avoid all medications. Answer: B. To reduce symptoms and prevent attacks. Rationale: the main goal is to manage symptoms and prevent asthma attacks. 99. What is the function of a nebulizer in asthma treatment? A. To humidify the air. B. To deliver medication as a fine mist. C. To increase lung strength. D. To diagnose asthma. Answer: B. To deliver medication as a fine mist. Rationale: a nebulizer turns liquid medication into a mist for better lung absorption. 100. Which symptom indicates a life-threatening asthma attack? A. Mild wheezing. B. Bluish lips and fingernails. C. Slight cough. D. Runny nose. Answer: B. Bluish lips and fingernails. Rationale: bluish lips and fingernails indicate severe oxygen deprivation, requiring immediate emergency care. 101. Which test is commonly used to diagnose asthma? A. ECG. B. Spirometry. C. X-ray. D. MRI. Answer: B. Spirometry. Rationale: spirometry measures lung function and airflow, helping to diagnose asthma. 102. What is the function of beta-2 agonists in asthma treatment? A. Reduce inflammation. B. Relax airway muscles. C. Increase mucus production. D. Cause coughing. Answer: B. Relax airway muscles. Rationale: beta-2 agonists, e.g., albuterol, help open airways by relaxing the muscles around them. 103. Which of the following is a possible complication of uncontrolled asthma? A. Pneumonia. B. Permanent airway damage. C. Respiratory failure. D. All of the above. Answer: D. All of the above. Rationale: uncontrolled asthma can lead to serious complications such as pneumonia, lung damage, and respiratory failure. 104. What is the recommended way to clean a meter-dose inhaler, MDI? A. Soak in boiling water. B. Wipe with a dry cloth. C. Rinse with warm water and air dry. D. Shake it vigorously. Answer: C. Rinse with warm water and air dry. Rationale: cleaning with warm water prevents medication buildup and ensures proper function. 105. What happens during an asthma attack? A. Airways become inflamed. B. Airways widen. C. Lung function improves. D. Oxygen levels increase. Answer: A. Airways become inflamed. Rationale: inflammation narrows the airways, making breathing difficult. 106. Which lifestyle change can help reduce asthma symptoms? A. Avoiding allergens and triggers. B. Exercising without precautions. C. Smoking regularly. D. Drinking alcohol. Answer: A. Avoiding allergens and triggers. Rationale: identifying and avoiding asthma triggers can significantly reduce symptoms. 107. Which of these is an example of a long-term asthma control medication? A. Albuterol. B. Inhaled corticosteroids. C. Antihistamines. D. Epinephrine. Answer: B. Inhaled corticosteroids. Rationale: inhaled corticosteroids are used daily to reduce airway inflammation and prevent attacks. 108. How can cold air affect asthma? A. It reduces symptoms. B. It can trigger an attack. C. It has no effect. D. It cures asthma. Answer: B. It can trigger an attack. Rationale: cold air can cause airway constriction, leading to asthma symptoms. 109. What is an asthma action plan? A. A document outlining asthma triggers. B. A personalized plan for managing asthma. C. A list of medications for flu. D. A cure for asthma. Answer: B. A personalized plan for managing asthma. Rationale: an asthma action plan helps individuals monitor and control their condition effectively. 110. Why should a person with asthma rinse their mouth after using an inhaled corticosteroid? A. To enhance medication absorption. B. To prevent oral thrush. C. To help swallow the medicine. D. To reduce dry mouth. Answer: B. To prevent oral thrush. Rationale: inhaled corticosteroids can cause fungal infections, oral thrush, so rinsing the mouth helps prevent it. 111. Which of the following is an early warning sign of worsening asthma? A. Increased nighttime coughing. B. Clear nasal passages. C. Increased appetite. D. Improved lung function. Answer: A. Increased nighttime coughing. Rationale: nighttime coughing often signals worsening asthma before severe symptoms appear. 112. What does stepwise approach mean in asthma management? A. Increasing medications only. B. Adjusting treatment as needed. C. Using only one type of medication. D. Ignoring mild symptoms. Answer: B. Adjusting treatment as needed. Rationale: the stepwise approach involves increasing or decreasing medication based on symptom control. 113. How does stress affect asthma? A. It has no impact. B. It can trigger or worsen symptoms. C. It strengthens the lungs. D. It prevents attacks. Answer: B. It can trigger or worsen symptoms. Rationale: stress and anxiety can lead to breathing difficulties, worsening asthma symptoms. 114. What is the purpose of a peak flow meter? A. To measure oxygen levels. B. To check heart rate. C. To assess airway narrowing. D. To diagnose infections. Answer: C. To assess airway narrowing. Rationale: a peak flow meter helps monitor lung function and detect worsening asthma. 115. What is the role of histamine in asthma? A. It reduces inflammation. B. It causes airway constriction. C. It increases lung capacity. D. It prevents asthma attacks. Answer: B. It causes airway constriction. Rationale: histamine triggers allergic reactions, leading to airway narrowing in asthma. 116. Which of the following is a sign of poorly controlled asthma? A. Frequent use of a rescue inhaler. B. No nighttime symptoms. C. Rare wheezing. D. Stable peak flow readings. Answer: A. Frequent use of a rescue inhaler. Rationale: needing a rescue inhaler often suggests poor asthma control. 117. What is the primary goal of quick relief, rescue, asthma medications? A. To prevent inflammation. B. To open the airways quickly. C. To increase mucus production. D. To replace long-term medications. Answer: B. To open the airways quickly. Rationale: rescue inhalers, e.g., albuterol, work fast to relieve acute asthma symptoms. 118. Why should people with asthma avoid secondhand smoke? A. It improves lung function. B. It has no effect. C. It can trigger symptoms. D. It helps clear mucus. Answer: C. It can trigger symptoms. Rationale: secondhand smoke contains irritants that can cause asthma flare-ups. 119. What should you do if asthma symptoms suddenly worsen despite medication use? A. Take a nap. B. Ignore the symptoms. C. Seek emergency medical care. D. Increase food intake. Answer: C. Seek emergency medical care. Rationale: worsening symptoms despite medication require immediate medical attention. 120. Which of these is a key part of long-term asthma management? A. Identifying triggers. B. Avoiding all medications. C. Limiting physical activity. D. Only using quick relief inhalers. Answer: A. Identifying triggers. Rationale: managing asthma involves avoiding triggers and using preventive medications as prescribed.